What if the future of healthcare isn't just about technology or policy, but it's more about who's in the room delivering your care? Right now, communities of color make up about a third of the United States population, but comprise less than 6% of practicing physicians. That's not just a pipeline problem, it's a placement, access, and investment problem. In this video, we'll explore how community rooted training programs like the ones you find at historically Black colleges and universities, community health centers, and the Health Career Opportunity Program funding, sponsored by HRSA, are transforming who gets to serve, where they practice, and why it matters for all of us. Hello, and welcome back to the Power to Rise channel. I am Rafat Fields. I am the CEO and founder of Power to Rise. And today we're going to be talking about why creating pathways for people who grow up within historically marginalized communities is really important in terms of cultivating the healthcare workforce of tomorrow and right now, actually, that is needed to improve health outcomes. Let's jump right in. Make no mistake, yes, this is a program that cultivates community engagement and is a good thing to do. What do we mean when we say representation matters in the healthcare workforce? Unlike other industries, there is real quantitative evidence alongside the qualitative data that demonstrates that having a relationship, a set of lived experiences that is shared between the provider and the person receiving care impacts the outcomes for that patient in a positive way. We have data that shows us this. It's a scientific fact. When we talk about a workforce that reflects America, we're not just talking about it because we think it's a feel good thing to do. It is what the data tells us is required to actually deliver the outcomes we're looking for. And even with this evidence, the reality is we've got a lot of work to do to make this happen. In the United States, the Black community represents 13% of the US population, yet only 5% of physicians identify as Black. Another key piece of information is that most physicians practice within 100 miles of where they completed their training. That has real implications for the communities that are most underserved. If there are training programs in those areas, there's a much better chance that we will have quality healthcare providers that share those lived experiences for those particular communities. The data also shows us that when patients are receiving care from those physicians where they have those sets of shared lived experiences, they have more trustful relationships with those providers and are better able to access care and interventions in a timely manner. The good news is there are several pipeline programs that already exist that are driving this meaningful change that we can look to as examples. Community health centers have been serving as training hubs for local providers for decades. These critical and vital clinics are often in neighborhoods and zip codes that are most lacking in infrastructure resources. And by putting training programs, residency programs at that community health center, it is meeting people where they are and creating access to that quality health care, but it's also providing that pathway for providers to train within those neighborhoods and have an increased likelihood of staying because they have those relationships and connections that ground them within those communities. Historically, Black colleges and universities continue to be a stopgap in building bridges and opportunities for students of color to access advanced practice medical careers. HRSA also has a funding program called the Health Careers Opportunity Program that provides grants and funding vehicles for the development of diverse talent within these community clinics. When we talk about the future of healthcare, we have to understand that it's going to be critical to intentionally build trust between the patients who need care most and the providers of that care. By nurturing pathways for people who are already in the community, it fast tracks that process of building trust. And trust is the linchpin in the whole system. If we want patients to access preventative care and to get to the resources that keep chronic diseases from escalating and minimize the need for more intensive interventions in scenarios that could have been treated at the earlier phases versus waiting until they reach more complexity, there's no better way to close the trust gap than to start investing in building leaders from within those communities. For this reason, culturally concordant care saves lives, improves outcomes, and saves healthcare costs. We also know that this is about long term presence and infrastructure. And people who grow up within these communities, who have those familial and relational ties, are going to be the providers most likely to stay and serve these communities. This video is being recorded on March 27th, 2025. We are well underway with the 119th congressional session, and we have some specific policy recommendations that we want to share and want to empower you to share with your community. There are a few things at Power to Rise we believe will accelerate building these provider pathways in historically marginalized communities. One is to encourage your local Congress representatives to pass the Workforce Innovation and Opportunity Act. It's known as HR 935. It creates funding vehicles to the programs that we've shared here. We're recommending deeper funding for historically Black colleges and universities, which we know produce the largest quantity of medical practitioners for communities of color. We also support the expansion of graduate medical education slots in high need areas. And finally, we want to see more support for community health centers as workforce development anchors. This is really critical in those zip codes that are from an infrastructure incredibly under resourced, including rural communities across the country. By creating these pathways, we are going to see more providers train in those areas and also have the relationships that support them staying and building those neighborhoods from both a health and economic opportunity standpoint. At Power to Rise, we believe in building a workforce that reflects and serves all. We also understand that having equity in the training construct promotes health equity throughout the healthcare system. And as we work towards creating better health and economic opportunities for historically under resourced neighborhoods, we believe healthcare is the most important and critical industry to begin. And the gains that we make here will have a ripple effect outward to improving opportunities across the entire economy. We look forward to being by your side as your ally in advocacy this year. If you have any questions, drop them in the comments below or be sure to send our team an email. All of the information will be linked below in the notes to this video. If you found this breakdown helpful, be sure to hit like and subscribe to the channel. Thank you for watching, and I'll see you on the next video.